Hi, my name is Brianna Christensen, and I was a Dimensions Fellows in Research at the University of Iowa in Rob Cornell's lab. So first, before I talk about my project, I would like to briefly talk about where I worked and the program that I was in over the summer. So I worked at the University of Iowa, which is a major research university here in Iowa. And what the Future program is, it basically takes professors from Iowa who bring in students, and it develops research partnerships between the colleges and the university, and allows us to use equipment that maybe we wouldn't get to use at our smaller colleges. So the project that I had was I used zebrafish embryos to determine 5-nitrofuran's effect on dopaminergic neurons, which involved using in situ hybridization and measuring motility and quantitative PCR and analyzing those results. First, what are 5-nitrofurans? They are prodrugs used commonly to treat bacterial and parasitic infections, such as Chagas disease. And this drug is really effective in treating Chagas disease. However, about 30% of the patients have to stop treatment due to side effects, which are usually gastrointestinal and respiratory. However, some of them are neurological, such as psychosis, which usually involves dopamine. And this is how we first got started in this project. We also found research that showed 5-nitrofuran had an effect on melanocytes, which are the pigmentation in the zebrafish. And if you can see in this diagram right here, melanin and dopamine have a very similar pathway. So we thought, well, if it's affecting melanin and we are having these side effects, maybe it is actually having an effect on dopamine. So what we did was we took zebrafish embryos that were 24 hours old, and we exposed them to various concentrations of 5-nitrofuran. And then we assessed their motility at 5 days old. And then after that, we used some of the embryos to do in situ for DCT and for qPCR for tyrosine hydroxylase, which is an enzyme used in the dopamine metabolic pathway that we saw earlier. And zebrafish have 2 variants of it, TH1 and TH2, so that's what we analyzed. So what this in situ allowed us to do was sustain the melanocytes in the zebrafish to see what was causing the depigmentation, because it could be either a death of the melanocytes or just a loss of melanin. And so by staining them, we could see how the melanocytes themselves were affected. As you can see in the controls, the melanocytes are pretty big, very branched out. However, the ones that have 5-nitrofuran, that were exposed to 5-nitrofuran, become smaller and more fragmented, which showed that the pigmentation is due to melanocyte death, just validating the results that we saw in previous research. And this is the results from our motility assessment. And as you can see in the controls, there's this pattern due to the 30-minute light and dark changes. What happens is when the light is turned off and it's dark, the embryos have a spike in movement. And they think it's because they get really scared and they think there's a predator over them, and so they start swimming really quickly to try to get away. And then eventually they relax when they realize that they're okay. And then it just repeats over and over. So we see this pattern in the controls. However, when we look at the embryos that were exposed to the drug, they don't have that pattern, and they're also having a decrease in movement, which suggests that there is an issue with dopamine. However, there could be other causes. So then we looked at the qPCR results for TH1 to TH2 to see if dopamine was affected. And in our results, we saw that there was a statistically significant decrease in both TH1 and TH2, which confirmed that the motility was off because their dopaminergic neurons are affected. However, then Barbara and I started talking, and we were wondering if it's specifically affecting these dopaminergic neurons, or is the brain being affected? Because overall brain death would also have the same effect. So then we did qPCRs for brain-derived neurotrophic factor and for glutamate decarboxylase. And BDNF allows us to look at the brain function overall, and then GAD allows us to look at neurons that would be specific to glutamate. And there was not a statistically significant difference between the controls and those exposed to 5-nitrofuran. So then we were able to conclude that this drug does specifically affect dopaminergic neurons. And you might be sitting there going, what does this have to do with me? You're doing all the science in fish. Well, as I mentioned before, this drug is commonly used in Chagas disease, and since it's so good at treating it, it's actually given free in the countries where Chagas disease is prevalent. And it's also used for urinary tract infections, and it's also being looked at as a possible cancer treatment. And since there are these awful side effects that come with taking this medicine, if we can figure out how to make it so this drug doesn't have these effects in these patients that need this drug, then it'd be a better drug for people, because then they won't have to stop taking it. I learned a lot in the 8 weeks that I was there, more than I was probably expecting. Scientifically, I learned how to create and execute a research project using various procedures. I also learned how to keep a lab notebook and the importance of keeping a lab notebook, just because we refer to it so often to see if there are mistakes made that contribute to results, and if we're repeating procedures. I also learned how to work with animals and the struggles of working with animals, because we were completely reliant on their reproduction. And some days it'd be perfectly fine and you would get hundreds of embryos and you could do your experiments, and then other days they would give you 3 and you can't really do an experiment with 3 embryos, unfortunately. And then I also learned how to give a poster presentation, and it was my first time doing that style of presentation, and it will probably be one that I will do more often, so I was glad that I gained exposure to that. Professionally, I gained exposure to different career paths in science because of the people I was working with, as well as the future program and the seminars that we attended, especially with the process of graduate school, because I worked with people who were just in their first couple years of it, rotating, and I was also working with other people who were finishing up and defending their theses, and just to see that whole process was really neat, and to see kind of what it would be like. And along with the animal handling, I learned how to be flexible. I'm the type of person where I like it when I plan everything out and it works perfectly and it's great, and science does not always work that way. So I had to learn how to adjust my plan and to make sure things were still getting done on time. And probably one of the most important things to me was I learned how to be a role model for my sister. She is in 6th grade now, and she is just getting interested in science, and she's thinking about going in that path. And I know, based on how, like, my journey with this, support is a really huge thing on maintaining your interest, if this is really what you want to do, and I'm hoping I can provide that for her if she chooses to do that. So there's her. She was able to see my lab, which was really neat. My academic impact, I improved my lab techniques, and I also started learning how to read scientific articles in a way that I'm going to understand them best, which will be really beneficial for the lab classes that I take here at Cornell. And then I also got practice presenting my research information, being able to convey my results to an audience of different levels. And I was also able to do an independent study project during Block 2, where I was able to go back to the lab and continue my research, which just was a really great experience to keep doing that and learning different things on how you find this result out. Well, you're not done, so you have to keep doing more and more. My professional impact is I learned about the medical scientist training program, which is where you get a PhD and an MD at the same time. And it is something that I'm interested in and thinking about. But even if I don't go that route and I just stick with being pre-med, this experience will really help build my resume for when I apply to those. And I also made connections with faculty and students, both at the University of Iowa and with other colleges through that future program. And there's a couple of the students in the future program that I worked with, and this was us at one of the symposiums we presented at. I would like to thank Dimensions and Cornell Fellows for the funding that allowed me to be able to go out and do this research position. I'd also like to thank Dr. Rob Cornell, because he was brave enough in taking someone who just finished their freshman year and doing research in his lab. And I'd also like to thank Barbara Christie Pope, because not only was she my faculty sponsor, but she actually went with me and we did the research together, and she really helped make sure I was understanding what was going on and learning the process of this. I'd also like to thank all the members of Dr. Rob Cornell's lab, especially the ones mentioned above, because they were really great in answering all of my questions, and Amanda especially oversaw a lot of my project over the summer. And I'd also like to thank specifically Julie Barnes and Megan Hicks for helping prepare me to have this research position, because it was the first time I've ever done anything like that, and it took a little bit of explaining to me what I had to make sure I was getting done on time. Thank you.